Hi, this is Jandy Wangstead, and I'm doing my video validation for administering medication. I just want to show you my room quick, and I'm limited to 10 minutes in order to get this up on YouTube. So if this is my recorder, by the way, my daughter. So if I seem like I'm rushing, that is why. I've tried this a couple times though and haven't quite made it. Okay, so I am going to administer 9 o'clock medication to my patient. I've already checked and made sure that she's there, she's ready, she has water. And so what I have here is her MAR and the physician's orders. And what I'm going to do is compare, first I'm going to do hand hygiene. Then what I'm going to do is compare the medications from the MAR to the physician's order. And so what I'm going to do is just kind of check real quick, and I see that I have 4 medications that are supposed to be administered at 9 o'clock. But when I look on my physician's orders, I find the Caflex 250 milligrams is on the physician's order, as well as the Lasix 80 milligrams and the Micro K 8 milliequivalents. However, digoxin is not listed on the physician's order, and it is on the MAR. So I'm not going to administer that medication right now. I've put a call into the physician, and hopefully he's going to get back to me as soon as he can so that I know whether or not digoxin is supposed to be on his physician's orders. So now what I want to do is, I know I'm also looking, I've got the right patient, Marsha Brady, and I have this little thing here with some medication in it. They're all pre-measured, but this is Marsha Brady's box, and it's got 24 hours worth of medication in there for her. So what I'm doing is I'm going to do my first check. I'm going to look at each one of my medications, and I'm going to make sure that the drug name is on here and that it's in the right dosage and that it's also not expired. So I've got my Caflex 250 milligrams. I'm going to put that right there on the MAR. Then I've got my Lasix, right drug, right dose, not expired. Speaking of that, that brings me to the patient's 5 rights. They have the right to get the right drug in the right dose, by the right route, at the right time, to the right patient. And also followed by some additional rules, which include following it with the right documentation, and that the patient has the right to know the side effects. I'm going to assess for the medical history to make sure that there's no contraindications as to giving these medicines. And we'll get to that too. So now anyway, I've got my Micro K 8 milliequivalents right here, not expired, right dosage, set it on the MAR. That completes my first check. I'm going to go back and I'm going to double check each of these drugs are the right dose, the right name, the right patient, the right expiration date. And then what I'm going to do is one at a time, I'm going to put these in here. And I'm also counting because I know that I was going to give 3 medicines. So there's 3 medicines in my cup. And then I probably wouldn't take the physician's order with me. So maybe I'll just leave that right here on my cart or in my book, wherever that is. And now I'm going to go over here and knock on the door, enter the room with the patient. And now what I want to do at this point is, first of all, get 2, you can come over this way a little, right? Get 2 verifications that this is the right patient. So I ask, what is your name? She tells me Marsha Brady. I say, okay, great, I've got the right person. She might have an armband on that I could look at. Also ask her date of birth. She says that it's 5/12/81, which is what it says on my MAR, so I know I've got the right patient. Then what I want to do is take out each drug. I'm going to do it one at a time, and I would show her, well, first of all, I'd tell her, you know, what each drug is for. We'll start with the Caflex. That's the antibiotic. She's going to want to make sure and take all of this medication so that she doesn't build up antibiotic resistance to it. Any other side effects that she might want to look for, any drug-to-drug interactions that might be there. And I would open it up and then give it to her, give her a drink of water. She can take the first medicine. I'd also have her notice what it looks like so that she's aware which medication she's taking and that she makes sure she's got the right one. So this one's done. Then we move on to the Lasix. I'd want to tell her this is a diuretic. You know, it's going to help flush out any excess fluid that you're building up right now. Something that you're going to want to watch for is, you know, don't You don't want to take too much of this with the digoxin if you do start taking that, because it can decrease the level and increase the chance of toxicity, and just again go through anything else. Before this though, like I mentioned at my cart, I've already went through and assessed my patient's medical history so that I know none of these drugs, especially like with the Keflex, you know, you want to make sure they haven't had any previous bad interactions with it, because it is, you know, if they've had any bad experiences with penicillin or any other cephalosporins, anaphylaxis can occur, which can be fatal. So you want to have an epinephrine with you when you administer that for the first time, and make sure and watch for that really closely. And I also know none of the other drugs, she hasn't had any bad experiences with those. So then I'm going to give her the Lasix, and this is my third and final check too. I am going through each medication again, making sure it's the right dose, right time, right patient, everything. So she takes the Lasix, then I'm going to give her the Micro K, and let her know this is a potassium chloride pill to make sure that she does not get an electrolyte imbalance, probably mostly from the Lasix that she's taking, which can strip the body of that. And also with this one, it's important to take it at the right time, within 2 hours. If you've forgotten and you remember, you can take this medication. Otherwise, wait until the next dose is needed. So she's taken all of her medication, and then I would follow that up with the right documentation. And then all I've got written here is a piece of paper to go through the medicine. I want to take you through eye and ear drops. Eardrops, with any of these, you're going to do hand hygiene first. You put on gloves. The eye drops, you would pull down the lower eyelid to expose the inner canthus, and that's where you're going to want to put the eye drop in. You have the patient look up at the ceiling. You don't want to put the drop on the retina or the cornea, because it can cause damage. And then also, in order to prevent systemic absorption, you're going to want to put light finger pressure over the lacrimal duct right after you put in the drop. Hand hygiene, very important with those. Ear drops, you're going to want to have the patient tilt their head to the side. For the adult, you're going to lift the pinna up and back. For a child, you'd pull down and forward. For little infants, you could probably have them just lay down. You're going to put the drops in, have them hold their head there for a little bit so that it can get absorbed. Transdermal patches. Transdermal patches, again, always put on gloves. You want to make sure your body doesn't absorb any of the medication into your bloodstream. So you first check the old patch. You want to make sure there's no skin irritation. It looks like any signs of infection or something going on there. So you remove that patch first. That patch will actually last for 30 minutes after you take it off. The new one's not going to kick in for 30 minutes. So then anyway, you put on the new patch. You want to look for a hairless skin area that has good blood circulation to it, like the shoulders, back here, upper arms, chest. And then anyway, you put that patch on. You would sign it, date it, put the time on there so they know when it went on. Inhalers. In order to use an inhaler, you would take the canister that comes with the inhaler, you'd insert it into the mouthpiece by holding it at the back of the mouthpiece. You shake it up really good so that it gets mixed up, and then you're going to hold it. You take off the cap on the mouthpiece, hold it 1 to 2 inches away from your mouth, exhale completely. As you're inhaling, then you would push the button to release the puff of the inhalant. You breathe in, you hold it in for 10 seconds, and release the air then. And like in the case of my patient, she can have 2 puffs as needed. There's lots of different things you want to watch out with those. You don't want to get too much of that either. We also need to mention the splitting or crushing of pills. If pills are able to be split, a lot of times they'll have a score mark on them, and that's where you would cut them, like say you needed to do them in half. You never want to crush or split enteric-coated medication, any of the sustained release medications, the substantial capsulated medicine. Those are the kinds you never want to crush. If you do need to crush it, you want to put it in some applesauce or some soft food to administer it to the patient. And that is all that I have. Again, I'm sorry if I rushed, but I'm trying to get under 10 minutes. Thank you.
You got 10:16.
Did you stop it?